anniversary, you can imagine how the rest of that tweet goes. Not allowed to use those words on morning or nighttime television, actually. Keep those coming in. Doctors in the UK are prescribing record doses of highly addictive painkillers. According to NHS figures, around 4 million people are taking opioids, drugs that are closely related to heroin. Painkillers containing opioids, such as cocodamol, are also available over the counter. But despite millions of people taking them, one online survey suggests more than 40% of people aren't aware that these kind of tablets are addictive. Let's talk now to Natalie Foster, who was addicted to painkillers until January this year. She's a 30-year-old mum from Liverpool and runs her own cleaning business. She was taking up to 15 codeine pills a day. Also with us, Dr. Claire Gerrada, who's a drug specialist for the Royal College of GPs. To Dr. Yasir Abbasi, who runs NHS Addiction Services on Merseyside and helped treat Natalie. Welcome all of you. Thank you very much. Natalie, let's start with you because you were first prescribed cocodamol by your GP 3 years ago, I think, for a hip problem. Yeah. 8 pills a day you were supposed to take then. What happened after that?
I was taking the prescribed dose for probably about 6 months. The pain was getting worse as the months went on. So I was increasing my dose to try and cover the pain. It took quite a while, but I was having to take more and more as the weeks, months, years went on. And in the end, it increased to about 40, 50 tablets a day.
And I think it did get to the point when you were lying to your GP to get more.
Yeah.
As well as buying stuff online as well.
Yeah, because I just didn't know what to do to get them. All you think about is, I'm sick when I don't have them, where am I going to get my next prescription from?
Dr. Abbasi, was Natalie addicted or simply heavily reliant on these tablets?
I would say she was addicted to it because she was taking these tablets more than prescribed, and she was sourcing it from other sources as well. It's a process which is very difficult to identify, and once the individual starts taking the tablet, it's very easy to fall into a routine of using it to allay your pain, but also then to experience dependent symptoms, which then leads you to start using more.
Dr. Gerrada, do you think GPs sometimes prescribe these kind of painkillers too readily?
We certainly do prescribe a lot of them, and increasingly the management of pain is really complex. We're urged not to use, for example, simple treatments like paracetamol or ibuprofen because they can harm themselves, and for patients in pain, that means we might go to these stronger painkillers as first line. So it is a problem, and it's especially a problem for the ones that contain paracetamol alongside the codeine, because strangely it's the paracetamol as well. So if you were taking 50 of these with paracetamol, you could be dead from liver failure from the paracetamol part, not from the codeine part. So it is a problem, and I think also, as we don't have ready access to physiotherapy, to osteopathy, even to massage treatment, what we're left with is painkillers, and they're easy to buy, they're easy now to get online, unfortunately, and I think many people don't realise that they're taking too many and that they can cause problems.
I don't know what the answer is then, because if you're in pain, Natalie, you're in pain, you want it to stop. It's horrible.
It's horrible, especially when you've got children. I've got a disabled son, so for me to be able to look after him, I've got to be well myself.
Of course.
But what I didn't know was that I'd become addicted to these tablets, and then I'd have to take them to get through a day to feel normal. And then obviously when I tried to stop myself, I was really sick, really bad withdrawal symptoms, really like flu-like symptoms.
So let me ask Dr. Abbasi then how you helped Natalie bring this volume of codeine and cocodamol tablets down.
You see, Natalie very nicely described her experiences of using these tablets and how the symptoms that she experienced were very confusing. So a lot of people who use this for some time become dependent on it like you would on heroin. And you experience these symptoms as she was, flu-like symptoms. They're very common, opiate withdrawal symptoms. And the is not to demonize these painkillers, because they are useful and they're used for if used for the right reason.
Sure, but what did you do? How would you just start to gradually reduce the number of tablets each day, or what practically did you do?
Well, there are a number of things that we can do, but with Natalie in particular, we moved her on to another tablet, and which was more concentrated in opioid, and we're gradually easily reducing that. Okay. But there are a variety of ways you can affect this. I think Dr. Gerrada earlier said there are not many other opportunities and therapies available. Even when you're treating this problem, there aren't that many psychological therapies available which we could offer people who are experiencing pain, and there's evidence to suggest that you could use psychological therapies like CBT in helping people treat pain.
So I mean, absolutely, he's absolutely right.
But if they're not available,
if they're not available, and that is the problem. Well, I don't know Natalie's case, but it may well be that a proper managed pain management process, even to referral to a pain clinic, because I think the issue was you were embarrassed, you were probably ashamed, you were doing this in secret, your pain wasn't under control, and it might have been that if you'd had access and you were able to see someone who was able to increase the dose properly, maybe add some other treatments in, rather than you suffering like that. It's also, Victoria, part of our ready access to medicines, and I think this is all part of a culture that if there's a medicine, we should take it, rather than actually there are other ways. I don't know whether with yourself, but there are other ways, for example, swimming, non-weight-bearing exercise, Pilates, all sorts of other things. But we're so rushed, all of us are so rushed, and your film shows these hundreds and thousands of medicines, and if you look at the table, 50 tablets, it's not unusual nowadays for people to be taking 50 tablets a day, not 50 painkillers, but 50 tablets. So
to manage all sorts of complex
things. So I think Natalie's very brave to have identified. The wider issue is about having other treatments to manage pain control and not readily to painkillers.
So how are you managing the pain now, Natalie?
I'm just coping with it at the moment.
Are you?
I'm on, the doctor's put me on another non-addictive medication.
Right.
It does take some of the pain away, but it's not completely covers it. I know I did ask the doctor to take me to physio, refer me to other ways to help the pain, and they were telling me that waiting list was 16 weeks.
Right. But you could go swimming. There's no way to...
I can go swimming and do stuff like that, but I wanted something... You need a quick fix for the pain, and doctors are just giving a quick fix. That's what they're doing.
Sorry, can I just...
Briefly,
come in there briefly, yes. I just wanted to say, I think the aim should be to increase the awareness around the possibility of becoming dependent on these painkillers. The patients using them might not be aware. Sometimes the doctors prescribing them might not be as much aware as we'd like them to. So the aim should be to increase the awareness around this and making sure that there are some services out there which are able to meet the needs of the individual. Because when people do become dependent on this, like Natalie, it's very difficult for them to build up that confidence and go to the mainstream addiction services to seek treatment.
Okay. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you.